Thank you for joining us on Health Diary. My name is Gladys Gashanja and we're coming to you from the Concord Hotel and Suites. Now, I'd like you to imagine a life where your body constantly attacks itself. Sounds surreal, right? Well, that is the reality those living with lupus have to contend with. Now, another reality is the numerous hospital visits and also the stigma that comes with it. We talk more about lupus on this episode, but before we get to it, here now is a fact of the matter. Lupus is a chronic autoimmune disease in which the body's immune system becomes hyperactive and attacks normal healthy tissues and organs. The most distinctive sign of lupus is a facial rash that resembles the wings of a butterfly unfolding across both cheeks. Lupus can be difficult to diagnose because its signs and symptoms often mimic those of other ailments. Inflammation caused by lupus can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart, and the lungs. Lupus is not contagious, and the numerous hospital visits presents a financial burden that lupus patients have to incur.
I found out about lupus in 2011, I think it's 11 or 12, when I was in Form 1. At that moment, I was suffering pain. I had joint pains on my knees and on my ankles. So like it was very painful.
First, it was, let me say, a shock. What is this lupus thing? Then I had to go and Googled. Then I saw a couple of IT affects people. Then I tried to relate it into what Immaculate is going through. I looked at it and said, okay, now here, Immaculate will be in this condition maybe for the bigger part of our life. And
when they started explaining much about that you're going to be taking medications for most of the rest of your life, your lifestyle is going to change, I hated that. I didn't like that. And hearing that from the point, because that time I was 14, so my feet were very swollen, my arms were also swollen. Also my cheeks, like my face was very swollen because of the steroids I was taking iron 22 pills per day. And then especially when it was cold, like now I developed a butterfly rash. So my face will be a little bit purple, whitish. So it was a very weird migo color thing. So my hair began falling off. My hands, the direction of my fingers, they would look kind of different. So it was very painful for me to hold anything. My skin would be so irritated, I wouldn't even want to wear clothes.
The test alone would top up to about 100,000. Medication per month at times would be 40,000, 50,000. At times you would be hospitalized. When you're hospitalized, that comes to about 1 million.
So for me, the first thing I can really say is have the right people around you. Once you have the right people around, they give you motivation, that which you need. They give you the right information. Because once you treat the wrong thing, you go already sad wrong. Lupus has killed a lot of people because of misinformation and you don't know how to treat it.
Well, lupus has been misunderstood because it has very many faces, and some of us who don't even understand or know how it looks like are health practitioners. But I have one who knows exactly what it is on set, and to help us understand more about lupus is Dr. Eugene Genga. He is a rheumatologist, and Jean Banda, who is living with lupus and is also the founder of Kenya Kidney and Lupus Foundation. Thank you guys for joining me. Now, Dr. How does the body get to a point where it starts attacking itself? What is going on?
Basically, what happens is that the way we've been designed is that the immune system is supposed to protect you from infections like the bacterial, the viral, and all that. But in certain scenarios, the body now changes. And instead of protecting you, it attacks you. As to why it does that is still a matter of debate. But we have theories. Certain theories include that maybe genetically you have some genes that make you at risk for developing that. At the same time, certain infections may maybe cause that to happen. So in short, you have what we call an autoimmune process. So auto means that the body confuses you for somebody else. Instead of protecting you, it attacks.
Okay, which is a very strange phenomenon, you know.
It's very strange. It's something which, if we were to talk about it like 200-300 years ago, we'd look like madmen.
Yeah. Now, Jean, you've been living with this condition for how many years now?
19 years.
19 years.
19.
Was that rash one of the symptoms? Because I know it doesn't happen to everyone.
No, for me, I didn't get the rash. Yeah, I basically experienced joint pains, extreme fatigue, loss of appetite, and obviously this stressed me. Yeah, so when I went to hospital, they thought it was arthritis. I was put on medication, and the disease progressed and ended up attacking my kidneys.
Misdiagnosis is one of the biggest issues when it comes to lupus, because one of the conditions it mimics is arthritis, and that's why she probably was told arthritis. What are some others that it manifests as?
The most common usually is skin manifestation. We call mala rash, a rash around the cheek. Actually, lupus means wolf bite because of the mala rash. It can also manifest with scars around the scalp. We call that vitiligo. We call that discoid lupus, sorry. Other ways it can manifest with the kidney, because the kidney, how it does, the job is to filter out the particles from the body. So what happens is that when it's not working well, you retain water. At the same time, retain salt, so you swell up and everything. Apart from that, it can go to the joints. The joints usually likes the small joints in particular, of the hands and the wrist. Other places it can go, heart can be affected, where it forms around the heart we have a sheath of muscle. So when it can get inflamed or on fire, we call that a pericarditis. But the most common sign at the beginning usually is fever. Other things are weight changes, either weight loss or weight gain. Those are some of the changes, and then the skin and the joint.
So if it has such symptoms, which sound like other conditions too, what should health practitioners look out for to say this is not everything else you think, but it is lupus?
So that usually is a tricky one because it depends on what time the patient is presenting. Other things that might help, I think, would be looking at the patient, because lupus is more common with ladies. And the age group is between 15 to about 55. That usually is the age group that mostly affected. There's an association of, if you have a family member with the lupus, that you could have that particular. And I think even Lady Gaga, who came out recently with lupus, she mentioned, I think her aunt had some lupus or something. Yeah.
So for you, Jean, what is the greatest trigger to the, what we can call attacks?
Mostly sunlight. So I tend to avoid the sun, and basically sometimes if I eat certain foods, it's not always the same one, because today I might eat meat and get no reaction, and but after a few months when I eat meat, I notice my joints start hurting. Yeah, so what I do is I listen to my body. I've just learned to go with what my body tells me and eat what I can eat at that particular time. Yeah.
Okay, and Dr. are there some foods that people who are living with lupus should stay away from, now that we've touched on diet, or even some activities or just general things that you should stay away from to trigger the condition?
Other things are infections, because the lupus suppresses your immunity, so you're at a higher risk of infection. In terms of diet, it's a controversial area. There's still no consensus about diet. But what I like what Jean has said, and that's what we tell our patients, you should be able to learn your body. Because one thing about lupus is that my lupus, her lupus, your lupus is very different and very varied. I'll take, for example, like the lupus in black skin versus the lupus in the white skin. The black skin is more aggressive versus the white skin.
Now, Jean, we're talking about the body attacking different organs, and yours was the kidneys first, right? Tell us about that experience.
What I noticed is my body began swelling, and I didn't know why. I couldn't fit into my clothes, and this stressed me further. And you know, you're not eating, but you're gaining weight. Apparently, it was the fluid retention. My kidneys were actually packing because my feet were really swollen, my stomach was swollen, my face was swollen. I was a totally different person. Yeah. Then when I saw a kidney specialist, I was put on dialysis immediately. Yeah, that's when I kind of like stabilized. It's always advisable to get a transplant once your kidneys fail, but however there is a challenge. People have not been sensitized on the safety of giving out organs. So it took me 6.5 years on dialysis before I could actually get a kidney. Yeah.
Literally 19 years later, you're still here, and
You
that's
know?
because of that transplant.
Precisely.
Yeah. Now, Dr. Tari, the attack on different organs and cells of the body, does it happen gradually or does it depend on the severity of a condition?
It depends on the severity, because what we've come to learn, I'll use the example of a hydra. Lupus has very many phases. So there's some people will get a milder form. Others, like for her, it's unfortunately starts with the kidneys. So every person is different. But usually over time, it's the role of the doctor to make sure they're monitoring for these complications. The routine blood works to the kidney, the blood and everything. That's to be able to guide the doctor, yeah.
Just describe to us a day in a life for a person living with lupus. What is the one thing you're most afraid of?
I do not know how the day is going to turn out, because at times I'm very okay in the morning, but come noon, something goes wrong and I might be unwell. Then there's a lot of hospital visits. So that's part and parcel of my life. A lot of admissions. And one just has to learn to accept that this is the way it's going to be and push on. So it is challenging, but workable.
Well, this is an internal thing that you have purposely done to survive this condition. But the question is, are those who live with those living with lupus understand what exactly they're dealing with? More on this conversation on lupus coming right after the break. We're talking about that condition that has many faces. Lupus is the conversation today on Health Diary. Still with me, Dr. Eugene, and Jean, who's been living with this condition for 19 years now. Now, Jean, living with this condition makes you see the inside of a hospital a lot more than the ordinary person. Tell me how this has impacted your life.
Initially, it did affect me. I hated hospitals. I didn't want to go. I'd try and prolong going for the visits, and this only made my condition worse. So it reached a point where I realized that, you know what, the earlier I go, the better, and I accepted that. And what I didn't mention earlier is there's the fluctuation in weight. There are times you lose so much weight, and then you gain so much weight. So, you know, your wardrobe just has to have all those sizes. And of course, preferably elastic waists, yeah? So once I learned to accept that this was my journey, my walk, it made things a lot easier.
Have you faced people who interpreted your symptoms to be something else?
Yes. I thank God my immediate family understood, and my parents as well. But I remember one of my dad's cousins coming, and when he looked at me, at that time I had rashes. This rash was really, really bad, and it went all the way down to my neck. So when he looked at me, he was like, so you've been getting rashes? I'm like, yeah, but the doctor says it will take time to go. I thought I was, you know, he was sympathizing. Then he goes, and you've lost weight. Do you cough? Have you lost your appetite? You know, are you vomiting? And I'm like, okay, in my heart, because I didn't want to speak. So now you're a doctor, you know? And with such visitors, clearly you realize I just wanted isolation from people. It was traumatic for my son who was growing up then. But all in all, I think awareness is needed, because many patients, especially the younger ones who are in their 20s, this can really, really devastate them.
Dr. Ari, what are some of the interventions that those living with those with lupus should take up to make their lives a bit easier and also understand about this condition?
So in terms of interventions, I think the most important thing is education. I think just telling the patients what lupus is, the symptoms, because they never quite seem to understand the fatigue part. And that especially in the morning when you wake up and you don't even have the energy to go to work, or the energy to even get out of bed. And then the point of the lupus is that today you are fine, tomorrow there's a flare. And those are some of the things which you need to empower patients.
Now, Jean, having lupus increases your risk of infection. They've said at some point cancer and pregnancy complications, but you have a grown son. So did lupus, was it diagnosed before or after the baby?
It was diagnosed after, but sometimes when I look back, it probably started earlier, because during my pregnancy, of course, I wasn't seeing any rheumatologist, but my son came earlier than we had expected. My son was delivered at 7.5 months. Yeah.
Miscarriage is one of them, because what usually happens is that with lupus, there's an increased risk for pregnancy loss, especially in the first trimester. But with advancing education and everything, we're able to understand it better. Now we know the science, and actually we talk with the healthcare provider, they can change it to baby-friendly medicine. And two, we have certain medicines that can actually be used to make sure you have a successful pregnancy. So not all hope is lost. But usually we advise our patients that at least it should be stable prior to conception. Usually if you're unstable, your lupus before conception, the outcome usually is not good during pregnancy.
The symptoms of lupus ease with age, and they get better, especially after 50. I think this is the one place I think most people would say growing older has never sounded so good. Jane, have the symptoms become better with time?
So much better. They're there, but seriously, life has just begun, you know.
Okay.
Yeah, because I can now do all the things I had wanted to do. Yeah.
Let's talk about the cost of treatment. Again, the hospital visits. You had to go through a kidney transplant, the medication to manage this condition. How does that look like?
In a given month, you might find patients using between 30 to 60,000 Kenya shillings in a month. And it's even worse for patients who have other complications, say whose hearts have been affected, the kidneys, because anti-rejection medication is also very, very expensive. That's why there's a lot of advocacy. And on World Lupus Day, one of the things we were hoping, probably seeing if the government can incorporate this treatment within the NHIF, because it is life-saving. It sustains life. Are we saying
at this point it's not incorporated at all?
No, not at all.
That is tough. First of all, like if you look at the age group of the patients, the working age group, and most of them actually lose their jobs. Research has shown that up to 50% stop work within 2-3 years. And then those who are working are not working at optimum levels because of the fatigue, sick leaves and everything. So like the drugs, like there was a drug we're just discussing with her right now, it costs about 200 shillings a tablet, which is very expensive. Yeah. So what we usually do, it's not the best medicine, but we try and find some way to, we go for sometimes older treatment, just to make sure the patient can get by, as a way to see if they can afford something better. But I think going forward, I think if HIV medicine can be subsidized by the government, I think lupus should, because those patients suffer. They suffer a lot.
Wow. Yeah, Jean, what does an ideal world look like for those living with lupus?
An ideal world would be one that is pain-free, one in which you have energy to do the things you want to do, and one in which you'll be able to achieve your dreams, make your goals, because with this condition, you're not sure, there's uncertainty of the future. If all that could be removed, then I guess it would be ideal.
What's your clarion call? Because I know you're very passionate about creating awareness around lupus. What's your clarion call?
I think first of all is advocacy. I think the patient support group should come out and push. We have lawyers amongst those patients, people who are prominent. I think they should find a way of putting for some legislature in the government. Secondly, I think on our side as medical practitioners, we haven't done the best in terms of diagnosis and trying to pick up these patients early, because if you were to pick them up early, from research from the West, because they pick them up early, the outcome tends to be better. And that includes like teaching in terms of the university graduates, because some of the universities don't have rheumatologists who actually teach there. So I think going further, something which we can do. But I think the most important thing is the government should come in, because I think they should find a way to, if not provide a full, at least subsidize the drugs, also take care of the caregivers, because the caregivers go through a lot.
Yeah, let me add on to this, Dr. Insurance is a tricky one. many of the patients are not insured because of their condition. And even if you had a good insurance policy, it will not be renewed. In the event that it is renewed, there's a limit whereby it will be over within a month, yet we know that this patient needs treatment almost every other day. They need medicine, they need to see the doctor, you people are going to ask for consultation fees. So what happens to this kind of patient? Yeah, and it's for this reason that we really want to advocate for the insurance companies to come up with something that is going to assist lupus patients. And more so, the government needs to really consider, this is the productive age. This is the time people are making their lives. So I think this is a national issue.
So some of the challenges that patients are affected include in terms of infrastructure. We have only one public rheumatology clinic in Kenya, and it's done in Kenyatta. So for somebody who is in Wajir or Turkana, it becomes a bit of a challenge coming all the way there to get specialized treatment. And you can see also with the lab works, which are more equally expensive, you won't be able to access them while you're there also.
Very well said. Well, that is Dr. Eugene Genga. He's a rheumatologist, Jean Banda, living with lupus, and also the founder of Kenya Kidney and Lupus Foundation, giving us a perspective of how those living with lupus have it really tough, but also challenging the systems there are to make sure that we invest more in helping those living with lupus. Thank you for joining me, and now it's time for the health tip.
You're not supposed to come with dirty shoes in the gym. You're not supposed to spill water everywhere because the floor is slippery, easily to get injuries. In the gym, when you're exercising, you need to follow the proper fitness regime or program given by your instructor. The other thing that you're supposed to do when you're working out, do what you're supposed to do. Go back to the basics. Do not have this ego thing where you see other people training, maybe they're carrying 100 kgs on your legs and you want to do the same thing and you're just a beginner. Start from down, going up. Just follow the program given by your instructor. If you're a lady, try to avoid having so many ornaments like earrings and necklaces hanging all over you. Just try to be comfortable and ease movement. Do not eat excessively because you're going to be very uncomfortable when you're working out. Just make sure you have just a little bit before workout, if it's depending on your workout, maybe a banana and a little bit of water. That's enough for workout when you're starting your gym.
Thank you for joining us on yet another episode of Health Diary. Remember, you can reach us with any query you have on our social media handles. My name is Gladys Gashanja, and we're coming to you from the Concord Hotel and Suites. Until next time, see you. Unasema tukupake mafuta. Okay. Oh, nakusikia sana. Yay. Okay, clean.